Hello friends, here is a reasoning question. It will be useful for first prof students as well as later on in the pharmacology or in medicine or NEET PG preparation, PG entrance preparation. Let's see what the question is. Catecholamines increase the heart rate and yet they also increase the stroke volume. Explain how. Now this is a very interesting question. Let's first understand the angle of this question and then we will explain the reasoning behind it. Catecholamines are excitatory to the heart, we all know that, and they have a positive chronotropic effect. That is, they increase the heart rate. Well, that's also known to us. Fine. Now, if the heart rate increases, that means each cardiac cycle duration will go on decreasing. I mean, if there are more number of beats per minute, each beat will have a less and less duration. Obviously, it means systole duration will also decrease and diastole duration will also decrease because cardiac cycle length itself has decreased. So, in that, the systole duration also will be less and diastole duration also will be less. In fact, proportionately, diastole will suffer more. It will get constricted more. But anyways, so systole duration decreases when the heart rate increases. Now, if the systole duration becomes less, there is less time available for systolic ejection, obviously. And therefore, the stroke volume should become less at higher heart rates. But that's not happening. We are saying that catecholamines, even though they increase the heart rate, they also increase the stroke volume. Stroke volume does not decrease. It actually increases. How is that? On the other hand, diastole duration will also decrease. If the cardiac cycle duration is less, diastole will also suffer, diastole will also be constricted and therefore diastole duration will be less. If the diastole duration becomes less, that means ventricular filling should suffer. Filling should become less because diastole duration has suffered. So if the filling is less, by Starling law, if you remember, more the filling, more is the stroke volume. Less the filling, less should be the stroke volume. So even by this logic, catecholamines decrease the diastole duration. That should reduce the filling. And if filling is less, by Starling law, the next stroke volume also should be less, isn't it? But what we are saying here is catecholamines increase the heart rate. At the same time, they also increase the stroke volume instead of decreasing. How is that happening? Now, with this background, let's understand in detail. Let's see what happens in the systole. What is the effect of catecholamines on systole? Catecholamines have a positive inotropic effect, or they increase the myocardial contractility. The strength of contraction of the heart, or to be precise, ventricles, it increases under the effect of catecholamines. How? Let's see here. Catecholamines, they act on the beta 1 receptor in the myocardium. In the heart muscle, there are beta 1 receptors, and acting on these receptors, the G protein, or to be precise, GS subunit of G protein, cyclic AMP, PKA pathway is triggered by the catecholamines. So there is more formation of cyclic AMP inside the cell, inside the myocardial fiber, and it triggers the protein kinase A pathway, PKA pathway. Now, because of this protein kinase A, this is important, phosphorylation of L-type calcium channel. If you have already read about it, there is L-type calcium channel through which calcium influx occurs in the myocardial muscle fiber, cardiac muscle fiber. So now phosphorylation of L-type calcium channel, which means what? What will happen? There is more influx of calcium. Now that is the crux of the matter. Under the influence of catecholamines, there is more and more influx of calcium into the myocardial fiber. And as you are aware, or you must have read, that in the heart there is something called as calcium induced calcium release. That is, ECF calcium enters the myocardial fiber and it causes further calcium release from inside the fiber. So calcium induced calcium release also will be to a greater extent after this effect has been initiated. So more sarcoplasmic calcium available. I think that is the key statement here. Under the influence of catecholamines, more calcium is available in the sarcoplasm. And if there is more calcium, uh, then of course the strength of contraction of a muscle is proportional to the amount of sarcoplasmic calcium. If there is more sarcoplasmic calcium, then it means there is greater amount of cross bridge cycling. Actin myosin interaction is much greater now because of the more amount of calcium in the sarcoplasm. So overall it increases dp by dt. dp by dt is increased. I'll just explain it in two sentences. dt is time unit. So denominator is time unit. And dp is pressure. Pressure generation by the fiber per unit time. That's dp by dt. That also increases because of increased cross bridge cycling. So what I'm trying to say here is, in less duration, systole duration is now less because heart rate has increased. So cardiac cycle duration has become less. Systole duration is less. In less time, greater tension is generated in the myocardial fiber. Strength of contraction increase. Greater tension generated means more strength of contraction and more pressure is generated by the ventricular muscle fiber. It means what? Obviously, it means more stroke volume. Stronger the contraction, greater will be the stroke volume. So this is how catecholamines increase the stroke volume even if with lesser systolic duration. Even though there is less systolic time available, less systolic ejection time available, in that less time itself, greater tension is generated by catecholamines by this pathway, and thereby more amount of blood is ejected. That's possible. In less time, more blood ejected during systole. Let's also see the effect on diastole. On one hand, we are saying in less systolic time, more blood can be ejected because greater tension is generated in the myocardial fiber. But we also know about the Frank-Starling law. So let's see what happens in diastole. See, if the heart rate has increased, what will happen? Cardiac cycle duration will be shorter. And if the cardiac cycle duration is shorter, diastole duration will also suffer. In fact, diastole suffers more than systole. So diastole duration is reduced, and yet, you know what happens? Diastolic filling does not suffer. In fact, diastolic filling increases under the influence of catecholamines. Surprised? Yes. Even though diastole duration has reduced, has become less, filling it does not suffer. In fact, filling increases. In less time of diastole, more blood is filled in the ventricle. How? Let's see this. See, this is a representative diagram for the sarcoplasmic reticulum in the cardiac muscle fiber. Now, you know that calcium was released for the contraction, for the systole. Then, as you know, in the muscle, there is a protein called as SERCA, sarcoplasmic endoplasmic reticulum calcium ATPase. It removes the calcium from the sarcoplasm. So sarcoplasmic calcium level will fall, and that is how the muscle relaxes. Any muscle, whether it is skeletal muscle or cardiac muscle. When the SERCA removes calcium from the sarcoplasm, the muscle relaxes. Now, in the cardiac muscle, there is another protein which is called as phospholamban. There is a protein called as phospholamban. This is a SERCA associated protein. The phospholamban is associated with SERCA, and it does what? Normally it does what? It keeps an inhibitory check on the SERCA. It slows down the activity of SERCA normally under normal circumstances. So slowing down the SERCA activity means what? Calcium removal from the sarcoplasm is also at a slower rate. Normally, I'm not talking about catecholamines right now. Normally, without catecholamines. This phospholamban present in the cardiac muscle fiber, it keeps an inhibitory check and it slows down the SERCA. So calcium removal is slow and therefore the relaxation of the cardiac muscle fiber during diastole is also a little slow. Now watch it. Catecholamines, they cause phosphorylation of phospholamban. This is a key statement. Phosphorylation of L-type calcium channel and phosphorylation of phospholamban. Now because of this, the phospholamban had a slowdown effect on SERCA. That slowdown effect is now removed under the influence of catecholamines. Phospholamban has been phosphorylated, so its slowdown effect on the SERCA is now lifted. It means what? It means SERCA will now very rapidly remove the calcium from the sarcoplasm, and removal of calcium from the sarcoplasm is rapid. That means there will be faster diastolic relaxation. So imagine that the diastolic duration of the diastole is reduced. Fine, because heart rate has increased under the catecholamine influence. Even in that less time of the diastole, the relaxation is much faster because of phosphorylation of phospholamban. And relaxation is much faster, more relaxation, that means filling is not affected, actually filling increases. Faster relaxation, that means in less time of the diastole, the ventricles relax much faster. That means they can accommodate more quantity of blood even during diastole. And if the diastolic volume, end diastolic volume is more, by Frank-Starling law, more the filling, more the stroke volume. So even the diastolic filling is helping to create a stronger contraction and more stroke volume in the next systole. So that's the effect of catecholamines. A very interesting effect, that they increase the heart rate and thereby they decrease the cardiac cycle duration, thereby they decrease the systole duration, they decrease the diastole duration, and yet they increase the strength of contraction of the heart, and thereby they increase the stroke volume. So that was the explanation to this particular reasoning question.